Hello and welcome to Pregnancy Info. Today we will discuss what is stillbirth and what are its causes and symptoms. A stillbirth is the death or loss of a baby before or during delivery. Both miscarriage and stillbirth describe pregnancy loss, but they differ according to when the loss occurs. In the United States, a miscarriage is usually defined as loss of a baby before the 20th week of pregnancy, and a stillbirth is loss of baby at or after 20 weeks of pregnancy. Here are some types of stillbirth. Stillbirth is further classified as either early, late, or term. An early stillbirth is a fetal death occurring between 20 and 27 completed weeks of pregnancy. A late stillbirth occurs between 28 and 36 completed pregnancy weeks. A term stillbirth occurs between 37 or more completed pregnancy weeks. Now, question is that how many babies are stillborn? Stillbirth affects about 1 in 175 births, and each year about 21,000 babies are stillborn in the United States. This is about the same as the number of babies that die during the first year of life. Because of advances in medical technology over the 30 years, prenatal care has improved, which has dramatically reduced the number of late and term stillbirths. However, the rate of early stillbirths remained about the same over time. What are the symptoms of stillbirth? Stopping of fetal movement and kicks, spotting or bleeding, no fetal heartbeat, heart with stethoscope or Doppler, no fetal movement or heartbeat seen on ultrasound, which makes the definitive diagnosis that the baby is stillborn. Other symptoms may or may not be linked to stillbirth. Now, there are some causes that we will discuss them in detail. Number 1. Problems with placenta or the umbilical cord. Your placenta is an organ that lines your uterus when you are pregnant. Through it and the umbilical cord, the fetus gets blood, oxygen and nutrients. Any problem with your placenta or umbilical cord and the fetus will not develop properly. Preeclampsia. Preeclampsia is high blood pressure and swelling that often happens late in pregnancy. If you have preeclampsia, you have twice the risk of placental abruption or stillbirth. Lupus. A person who has a lupus is at risk of having a stillbirth. Clotting disorder. A person with a blood clotting disorder like hemophilia is at a high risk. The pregnant person's medical conditions. Other illnesses can sometimes cause stillbirth. The list includes diabetes, heart disease, thyroid disease, or a viral or bacterial infection. Lifestyle. If your lifestyle includes drinking, using recreational drinks and or smoking, you are more likely to have a stillbirth. Birth defect. One or more birth defects causes about 25% of stillbirth. Birth defects are rarely discovered without a thorough examination of the fetus, including an autopsy. Infection. An infection between week 24 and week 27 can cause fatal death. Usually it is a bacterial infection that travels from the vagina to your uterus. Common bacteria include group B Streptococcus, E. coli, Klebsiella, Enterococcus, Haemophilus influenza, Chlamydia or Mycoplasma or Ureaplasma. Additional problems including rubella, the flu, herpes, Lyme disease and malaria. Among others, some infections go unnoticed until they are serious complications. Trauma. Trauma such as a car crash can result in a stillbirth, and it can be a sudden bad news, for example of death or accident, etc. can cause stillbirth. Intrahepatic cholestasis of pregnancy or ICP, also known as obstructive cholestasis. This is a liver disorder that includes severe itching. Pregnancy and labor complications. Problems with the pregnancy likely caused almost 1 in 3 stillbirths. These complications include preterm labor, pregnancy with twins or triplets, and the separation of placenta from the womb. The placenta provides nutrients and oxygen to the fetus, so pregnancy and labor complications were more common causes of stillbirth before week 24. If you are pregnant with multiples like twins, triplets or more, then it can be also the cause of stillbirth. you had complications in a previous pregnancy like preterm birth or preeclampsia or fetal growth and restriction. Preterm birth is a birth that happens too early, before 37 weeks of pregnancy. Preeclampsia is a condition that can happen over the 20th week of pregnancy or right after pregnancy. It's when a pregnant person has high blood pressure and signs that some of the organs like her kidneys and livers may not be working properly. Fetal growth restriction is when a baby doesn't gain enough weight in the womb before birth. Another cause of stillbirth is that you have never given birth before, so it's your first delivery. You had a miscarriage or stillbirth in a previous pregnancy. Miscarriage is when a baby dies in the womb before 20th week of pregnancy. You are pregnant after the age of 35 according to the American College of Obstetricians and Gynecologists. Studies show that a large number of stillbirths that happens among pregnant people 35 or older are related to congenital or chromosomal conditions. You have little social support. Many unmarried people have strong social networks of families and friends who help them. However, some studies have reported a high risk of stillbirth among unmarried people. Researchers think that this may be because they have less social support. Another cause is that if you are a black mom, then you have twice chances of bearing stillbirth. So this is all about stillbirth, its causes and its symptoms. Share this video with the females who are suffering the problems and who want to know that what is stillbirth and want to have safe pregnancy. For more such informational videos, you may subscribe our channel too. Thank you.